Daniel, great to see you. How you doing, bud? Let me go ahead and chime you in right now. I'm going to crop you into your spot in 1 minute. Folks, give us a quick time here so we can get Dr. Cohen into the fold as we crop him into the system. Right, as you can see, folks, we don't have an operator here. And the reason we don't have an operator is we can't get an operator quite yet. Maybe when we are funded, right, Daniel, we'll
That's
get
the
an
spirit.
operator.
Yeah, man. Fund the
How you,
resistance. Fund alternative media. Fund
yeah,
independent media.
absolutely. So how you doing today? How are you doing today?
I'm great, man. I'm back, back in the grand old United States. I got a chance to see a completely different world, as I mentioned to you earlier. So I'm fresh off of a plane from Morocco as of 2 days ago. So.
Well, I tell you, while I set you up, why don't you tell me about those good things that happened to you in Morocco?
Oh, it's a beautiful country, and everybody should go. You got to take off your United States lens for a minute and see somewhere else, right?
Mm-hmm.
It's an opportunity to go and talk to people about a different kind of world. Very nice people. I was in Marrakesh. I had a chance to go out into the desert, and it's just a different way of thinking, different way of life. I heard the Muslim call to prayer 5 times a day. I don't normally hear that. I had the opportunity to go through the souks. I got a chance to smell fresh saffron, eat dates and olives that I've never eaten before, fresher and tastier than I've ever had. Had a chance to meet a camel named Ferrari. It was a very sweet animal. So it was a completely different kind of world. Tolerance is definitely a practice in Morocco. I went and visited a very very old synagogue there. Had a chance to see some very beautiful designs, beautiful carpets, beautiful symbology. So I recommend it to anyone if you are fortunate and privileged enough to have an opportunity to go to Morocco.
Now, Morocco is a Muslim country in general, right?
It is, yeah, it is, but it is fairly it's fairly secular in terms of the population in many respects,
Uh-huh.
but it is very heavily Muslim majority, and it is very friendly in terms of most aspects of religious practice. There are certain things here and there that there's still some holdover, but the king there is secular, I guess. So you know me, I'm a democratist myself, but of course it is a kingdom. But I would say maybe 1% of the people there are interested in something like a Saudi. Most people in the Muslim world are not interested in living in a sort of Saudi Arabia or something like that.
Yeah,
That's
most people, the funny thing about it is what you find is most people around the world are just your basic good people, just basic.
Yeah, somebody said to me, they said there's good people and bad people everywhere. And he was a guide, so he's met people from all over the world. So he's met people from South America or Asia or Europe, United States, whatever it is. He said that there's good people and bad people everywhere, and I've met all kinds of people from all kinds of places. And I think that was a pretty accurate description of it. And most of the people that I met in the country of Morocco were very, very kind to me, very accepting, and wanted us to have all of the good experiences that someone would have when the first time you're visiting somebody's country. So
Well, excellent. Now, Daniel, one of the reasons we're on is, first of all, we need to do this more than once since people come and go. You're having an activity that you want to announce here in town as well, right?
yes. So I'm very excited to say this. This is the first ever Indivisible Texas U.S. Senate candidate issue forum. So we're going to have an opportunity to learn the positions of at least 5, possibly more, Democratic U.S. Senate candidates for Texas. Excuse me, I'm tripping over my tongue, I guess. It's going to be Tuesday, December 10th at 7 p.m. at Lily Grove Church at 7034 Tier Wester Street. We have 5, count them 5, confirmed U.S. Senate candidates for the state of Texas that are going to be on stage. So we're going to get to learn a lot more about what's going on with them. Cristina Simpson Ramirez, Simmer Hernandez, Royce West, Amanda Edwards, and Chris Bell are the 5 confirmed candidates. And we may have more that confirmed later on, but that's 5 candidates right there who can tell you there are differences in positions. It will be moderated by Texas Tribune's Patrick Svitek. So I'm very, very excited about this. Very excited to see how they respond to a room full of indivisibles. And of course, you know where we come from. We want to see a progressive agenda as indivisibles. So we're excited to see what these candidates have to say as they head into an electoral cycle to take on Senator John Cornyn.
Excellent. Now, one of the other reasons that you're here is we were talking about earlier, we're talking about the progressive agenda and where we believe, many of us believe, we really need to go. We think many times we are a bit, our narrative is incorrect, in my opinion, and this is where I come through. And I think what we haven't done a good job of is letting people understand that just like progressivism is an ideology and being on the right is an ideology, centrism is also an ideology. And what we also have to do is really take a look at the tenets of each of these and determine which one of these best fits our current situation, the current situation of all our citizens, and act accordingly. I think one of the issues that you and I discussed earlier was that the progressive movement, even though it is active and we want to do some things, for all practical purposes, it's too darn soft as far as calling out what's right about them and what's wrong, not only about people on the right, but what's wrong and what centrism is actually doing to the body politic and why it isn't the thing that's bringing people into our fold, bringing people into our vote. So why don't you expand on that if it is something that you want to expand on?
Yeah, I'd love to talk about this. I love this conversation, right? And you know, it's interesting because, you know me, I'm pedantic, right? So we'll kick it around a little bit. You know, I sometimes wonder about centrism because you make a good point that there's an ideology behind it in terms of, you know, that lands somewhere and there's got a worldview. Everybody's got an ideology. But on the other hand, I sometimes wonder if it isn't just, you know, you toss a coin and wherever it lands dead center between the right and the left, boom, I'm a centrist, right? There's not a lot of times you ask people what they like about these centrist candidates and they'll say something that's so abstract and so fluffy. There's no idea, you know, there's no ideology behind it. There's no ideas. So there's nothing like, you know, oh, this person's smart and they're reasonable and they're tough and they're this. But when it comes down to it, they couldn't tell you where they stand on criminal justice. They can't tell you where they stand on taxation and who should be taxed and who shouldn't and what we should do to make sure that people either are paying their fair share or what the rules should be on corporations. They can't tell you what should be done with the healthcare system, or they have no idea in terms of they repeat talking points that have been put out there through these pharmaceutical and insurance companies that have been push-pulling these ideas into the heads of the general public. They can't tell you where these people stand on environmentalism and why people should or shouldn't be against or for a Green New Deal or anything else. It's almost like I respect, in a way, the people out there who look you in the eye. You know, I think it's horrifying, but I think if someone really knows where a Mickey Bloomberg or a Pete Buttigieg stands and can look you in the eye and say, yes, I believe this, right? I believe that we need to bring jobs to the U.S. and we need to sign these giant multinational corporation-friendly trade deals because it's going to improve the lot of life for these people or something like that. There are people out there that believe that. And they really do believe it in their heart, and they're willing to say that to you. But there are other people out there that say, well, you know, we need to stop these purity tests. There's not a difference between this policy and that policy, when in fact there is a huge
big difference.
Enormous differences. I mean, if you look at the difference between a national federal single-payer healthcare system, commonly marketed as Medicare for all, if we want to use that to cut back syllables, then that is a single pool, right, as a completely different system by which you cut out all of the grafters and corrupt, crooked thugs that are picking people's pockets and robbing them blind and using grandma's body for blood so that they can profit on the back end and the backs of people like you and me, versus something that's just a giant subsidy for these companies. It basically is hush money. Please don't kill my grandmother. I'll give you another $1 billion in profits so that you can ride in on a golden parachute. Those are different policies. Those are not the same thing. It's not a purity test to say those two things are different any more than it'd be a purity test to point at the night sky and say the sun's not there. No one would ever point at you and say, hey, don't be so cruel about it. The sun is somewhere. It just doesn't happen to be visible right now. They're different things. There are facts and there's fiction. And these things being different things is a fact. It's propaganda to express otherwise.
I think what you're saying is so important, and the part that I think we have to get across here is that somehow, trying to tag to the center is not something that's hurting people. I think what I think a lot of times is that many of us, and I'm just speaking in the aggregate, and I include us because it's a must to be humble, but many of us are lazy. In other words, it's so much easier to claim you're tacking to the center than it is to teach, than it is to educate, than it is to say the pharma company that is advertising these drugs, they advertise it as being XYZ. They advertise it as if they had to pay for the initial research when we did. The the company, there's a group now called for the Healthcare of America, Partnership for America's Healthcare. That's a new company. That's a new organization created to kill Medicare for all. It's an organization of hospitals, doctors, and everybody else to destroy Medicare for all. And they decided, along with Biden's people, how is it best for us to turn people against Medicare for all? How is it best to do that? And they found the key words that's necessary to do that. It is incumbent on our part to go out there and say, they are misleading you because, as a good example, one of the big things that they say is tell people that their wait times are going to go up. I have a friend who's waiting to see a specialist who's on Obamacare right now that has to wait 3 months to see a specialist. What is that about wait time? Now, I have a friend in England who says, oh, her wait time for a specialist may be a week or two. But we're here with private insurance because HMOs do exactly what HMOs are like a whole lot of, like hundreds of rationing agents.
Yep.
And we don't sell it that way. We don't have people that go out there and explain to a person or use people's reality. How do we tell that person? In other words, every person had to see a specialist at some time. Let's say 10-15% of the population. So they have a relative who knows that as well. How difficult is it to tell that person, remember how you waited for that specialist? And you say.
Look, in 1992, 1993, one of the first things that Bill Clinton, if I remember this 100% correctly, because I remember most of the details here.
Right.
I'm pretty sure about this, and this is the most Bill Clinton thing to do in the entire world. He said, look, we could, we could push this policy or that policy. What should we come out of the gate with? It's going to guarantee to be highly popular with the American people. And I'm assuming that he was in a room and he said, what's the thing that people hate the most? And somebody said, I'm tired of telemarketers interrupting me during dinner. And he said, we're going to ban that, right? Almost everybody in Congress outside of Tim Ryan and like 7 other House reps with telemarketing, with call centers in their district voted for this thing, right? Had 93% approval rating, washed a bunch of auto dialer companies out of the market. It was like this highly popular sort of piece of legislation. Didn't exactly, widespread improve the lives of people everywhere, but people hated telemarketers, right? I think today the insurance representatives are pretty much the telemarketer.
Right.
You talk to somebody about insurance companies and they don't tell you the price. They lead you through a bunch of hoops. You don't know which doctor you're allowed to see. You have to wait to go to one. You have to go to a clinic that's farther away from you. And none of this was by design whatsoever. None of it. It all just popped up from years and years and years ago. Corporate robber barons have been doing this for 200 years. And now we're all convinced that this is the only way that you can do it. Whereas we know for a fact that people have been exploring single-payer healthcare models all over the world. They say things like, how are you going to pay for it? Right now, I'm getting my pocket picked every time I want to see the dentist. I don't even know what I'm going to pay when I go in to see the dentist. And dental and vision and mental health get cut out of it. Anything that's related to transit is a scam. You can't get a ride in a way unless it's going to be a scam or a kickback for Uber or Lyft. I mean, the entire healthcare system is a scam. And if people say, well, I don't want you to take away my insurance, no one out there is going to look at their budget and say, please charge me money for worse care. Because when I look at my bill at the end of the month, I'm going to miss that $4,000 line item for my family, right? And it cost me $30,000 to have a kid this month. It cost my friend $100. It cost my other friend $4,000. I don't know what the difference is. Somebody in a hospital somewhere decided that bonuses had to be bigger that month, and that kid was more than this month, or whatever it is. The United States healthcare system is madness. And if you're a centrist, you support it. And if you support Medicare for all, you want to fight it. And that's a fact. Those are two different things. Universal coverage used to mean a federal single-payer healthcare system. That's what they were saying when they said universal coverage. Now it's just been turned into this access point. Egberto, I have access to buy a helicopter, but that's not going to put me in the seat, man.
I love that. I love that analogy.
It's a joke.
You know, that is so prescient. Let me tell you something, okay? And you are, again, remember I said right now, even progressives are a little bit too nice. I think we need to really tell people what is happening, okay? Centrist support for our current medical system. Centrist support for a system that is based on private companies taking a top line off of your monies, which also increases your costs and others, costs people their lives. Yeah. Many people have to forego health care because they cannot afford it no matter what. Even if they have Obamacare, they have Medicare or whatever, because even standard Medicare is 80-20. There's also still a donut hole. There are a lot of reasons why our current healthcare system is still killing people. And if you understand deep within your heart that that people are dying because they can't get care, you are saying that, first of all, you don't believe medical health is a right. Okay, I can deal with that. I can deal with you not thinking it's a right. But if you think it's not a right, and you also think it is okay for somebody to die because they cannot go to see a healthcare provider, please tell me what that says about you. And that is where centrists are. I hate to put it that graphic because nobody wants to feel like they're complicit. But when you do not support a system that gives everybody health care, period, punto final, you are complicit in having many of your fellow Americans die. You say, sir.
You're absolutely right. And if we can pivot a second too, this is across the board. Because we've used healthcare. Healthcare is a useful example because it's just the system is just so maddening. But let's move to another system that's maddening in the United States, the prison system. Right? Is if you believe in a centrist perspective on the prison system, if you believe in the middle ground on the criminal justice system, then what you believe in is mandatory minimums that disproportionately punish Black people, poor people, brown people, Latinos, immigrants. You believe that it's okay to punish people based on the zip code they're born in, based on who their parents were, based on what state they're in. You believe that it's okay to have disproportion between those things. And this does not make anybody safer. Nobody goes into prison and then comes out later on and says, you know what, that was the best possible experience. That was, and it's,
right.
The majority of the time, if you want someone to turn their lives around, it really has to be something that happens. Most of us, ideology, psychology, the way that we think is a very complicated thing. It does come partly through discussions, but it largely comes through experiences. The same way that a lot of people who start thinking the way that you do about healthcare, or the way that I do about healthcare, started thinking that way because they met someone who got sick, or because someone they loved got sick, or they themselves got sick. And the same thing is true of the prison system a lot of times. Unless you get screwed by the prison system, you don't think differently about the prison system. You buy into this tough on crime idea, but it doesn't make us safer to be tough on crime. And it's not tough on crime in the first place. It's tough on people. It's tough on families. You're cutting funding for education. You're cutting funding for all of the things that are social determinants for whether or not people go to prison, so that you can build more prisons, so you can pay for more cops, so you can incarcerate more people, and you can do it on taxpayer dollars. So you're doing it in our name. And that's not the same thing as somebody who wants real criminal justice reform. Those are two different things. Those are not the same thing. And most people don't look at the track record of some of the larger candidates out there to see the difference between these things. I hate to pick on her because I can pick on a million different presidential candidates right now. That's how many we're up to now, right? 1 million in the Democrats.
Yes.
But so I hate to pick on this person because I could pick on Mickey Bloomberg with his stop and frisk. That's a really good example right there. I could pick on Tom Steyer and say, get your billionaire butt out of this race. There's so many different people that I could point to say, get out of the Democratic primary. There's a guy who dropped the other day. I don't even remember his name. I was like, I said to myself, literally, who is this?
The guy from North Dakota or South Dakota, yeah.
I guess. I mean, he may as well be from Mars, right? I have no idea who he is. I don't even know if he's eligible to be president. I've never heard of the guy. What I tell you is that they haven't been gaining traction. But someone who I have seen gain a little bit of traction that's moved into the media has been referring to as a dark horse, roughly in 5th place, let's say, right? You got your Biden, Bernie, Warren, right? Those is Amy Klobuchar.
Right.
You hear Amy Klobuchar's name as sort of the 5th dark horse candidate.
Right.
And you hear a lot of this fluffy discussion about Amy Klobuchar. She's tough. She's smart. I like her. She's sharp. She's likable. She had a great debate. People say these soft kind of things. Well, here's the truth about Amy Klobuchar. Before Amy Klobuchar was a Senate, her stepping stone to that Senate seat was as a prosecutor in a small Minnesota county for 8 years. And the Minnesota NAACP president pointed out that she did nothing to prosecute police violence, that there were police murders in her county that she did not prosecute. She didn't prosecute a single one of them. She didn't even approach a single one of them. She wrote editorials about being tough on crime, prosecuting truancy for kids who were out of school. You think a kid that's out of school, do you think you're going to solve the situation by throwing them into juvie or throwing them into detention or throwing them in prison? Obviously, the kid needs help. Amy Klobuchar decided to put the kids in prison. She started doing zero tolerance for minor drug possession offenses and things like that instead of advocating for people to have mental health services or, substance abuse services. What you get back in return from a lot of people is she's a prosecutor. She did her job, but that's wrong. First of all, she has discretion to prosecute certain things or not. So the way that you do your job as a prosecutor is partly determined by you. And in fact, you're the one in the driver's seat, right? So maybe she had certain guidelines in some situations, but in other situations, she could have dropped charges or she could have prosecuted differently, and she didn't. So that's one. Two, she wrote editorials in favor of these policies.
Yes, it's there in black and white.
It was very, very clear what she believes about these things. So for her to come out with a criminal justice reform plan that's supposedly so forward-thinking when she's running for president, it goes back to an old classic statement about, right, when someone shows you who they are, believe them. Don't believe the promises of a politician. Believe the track record that they showed you before. And this was a huge part of her political career. I mean, that's how she got to the Senate in the first place, was with the mass incarceration policies that led to the institutionalization, incarceration, murder, and family separation of black families, largely black families in Minnesota. And in Minnesota, which is largely white, she didn't have to pay the price. She didn't have to pay the piper because she was able to get a majority of the votes. I don't know about you, man, but if there's a room full of 10 people and 6 of them want to do something disgusting, that doesn't make it moral. And just because Amy Klobuchar was able to win elections doesn't mean that what she did was moral. And I don't want someone immoral in charge of the United States. I don't even want her to be VP or AG. So, I hate to pick on her, but if she's going to be the one that's gaining traction, then we need to talk about this. Amy Klobuchar is a worse version of Kamala Harris. Kamala Harris had some bad prosecutorial policies, but she was better than Amy Klobuchar, and she's shown contrition. She's been apologetic about it. She's changed her mind over time. And it's because Kamala Harris is more in touch with the needs of people who are black, brown, poor, immigrant, people who come from these communities. And Amy Klobuchar is not. And there's a difference between those two people, much less a difference between Amy Klobuchar and someone who's actually a criminal justice reform advocate.
I am so glad it's you who said that, because it's something I wanted to say. But given that I've been on all of these centrists' backs, it's great to see somebody else who thinks alike. Daniel, we are almost out of time. Why don't you give me a quick closure?
Yeah, I'd love to tell you again. First of all, you can always check us out at indivisiblehouston.org. We in the Houston area will be pressuring politicians for progressive outcomes and holding them accountable and holding them to their feet to the fire to make sure that there is transparent policy in our city. So we are watchdogs of the policies that these politicians are putting together. I also want to say one more time, the Indivisible Texas U.S. Senate Candidate Issue Forum. Indivisibles will be watching the live stream from all around the state. If you are here in Houston, then you can come out to it. It is Tuesday, December 10th, 2019, from 7 p.m. to 8:30 p.m. at Lily Grove Church at 7034. That's 7034 Tier Wester Street, Houston, Texas, 77021. Again, that's the Indivisible Texas U.S. Senate Candidate Issue Forum at Lily Grove Baptist Church, December 10th. That's this coming Tuesday, 7 o'clock. That's at 7034 Tier Wester Street. Egberto, as always, I love talking to you, man.
Let me tell you, folks, you are listening to one of the most... earlier this week, I had I had another Houston activist on. We just have a blessing of Houston activists in many, many different. We had Candice Weber on earlier this week. Now we have Daniel J. Cohen. Daniel is also an activist of activists. He's really taken Indivisible Houston places. So please remember that in your donations as well. Indivisiblehouston.com. Indivisiblehouston.com. Let me tell you, we have to invest in our progressive organizations. And this man here, he is working every single neighborhood in the Houston metropolitan area. He's doing as hard as he can to make sure we get those progressive votes out. To make sure we get those votes out, we're going to make sure that folks become progressives. Daniel J. Cohen, president of Indivisible Houston. Thank you so kindly for being here, my brother.
Thank you for being a member of the Free and Independent Press.
Absolutely, brother. Thank you, guys. Hey.